Good morning, lovely parents. Happy Tuesday to you. So today I'm continuing my talks on my head to toe MOT of your baby. And today I'm going to be talking about bones and soft tissue. Now, I'm going to start with talking about your baby's bones, and in particular, the importance of vitamin D for your baby and calcium, because this is what will build healthy teeth and bones. Now, unfortunately, if you're living in London or indeed the UK, we don't get very much sun, and the sun is absolutely essential on our skin for many reasons, but one of the main reasons is that we produce vitamin D when the sun shines on our skin. And in the UK, sadly, we don't get very much sun. So this can be a problem because it can make our children's bones a little bit soft. And babies' bones are soft anyway. It takes time for them to ossify or to build up the calcium to get strong. Now, when your baby starts weight bearing or indeed walking, you may notice that their legs are a little bit bowed. Now, this doesn't happen in every baby, but I just want to make you aware that we can get a condition called rickets. Now, you may associate rickets with a third world country, and you'd actually be wrong. I have seen many cases of rickets in the UK, both as a health visitor and a children's nurse. So I would always recommend that you supplement your babies with a good multivitamin to avoid these sorts of things. Even if your baby is having a balanced nutritional diet, it's still no harm to supplement with a multivitamin. And I did this with all of my children because my eldest child was very picky and he had lots of allergies. So I just made it routine that I was going to supplement him and my other three children. So I just really wanted to mention the importance of calcium and vitamin D for your children's teeth and bones before I moved on to what I plan to talk about today, which is talipes or clubfoot. Now, when you are pregnant and your baby grows inside in the uterus, by the time they get to 8 or 9 months, they're pretty much running out of room. So sometimes what can happen is that the feet can get a little bit awkwardly positioned. And some babies are born with a condition called positional talipes or clubfoot. And this can be really distressing for parents to see. But it's not anything to worry about, although it can be more serious in some babies. But positional talipes or clubfoot is quite easy to manage. And it is called positional talipes because of the way the foot has got positioned in the uterus, really. So the way that you will recognize it is that the foot is pointed upwards and inwards. So instead of being in midline alignment, so to speak, it's off. And the way that you can manage it, the reason it's off is because the Achilles tendon is really tight and it's pulled the foot into that upward inward position. Now, to be able to manage it and address it, it's really simple. All you have to do is some gentle foot exercises. And I used to teach this to my parents when I'd visit them in the home. So sometimes tickling the foot can help because it makes the child stretch out. But what's more effective is gently rotate the foot, first of all, just to kind of loosen the Achilles tendon up a little bit. And then what you need to do is stretch it to the opposite side. So stretch it upwards and outwards in opposition to the inward position that it is the preference. Now keep doing this several times a day and you will see a marked improvement as you stretch out the Achilles tendon. Now, if there isn't any improvement in a couple of weeks, your GP will be doing a 6-week developmental check. This is routine for all babies. And that's the time to speak to your GP about it if there isn't any improvement. Now, the GP will recommend a couple of things. One is that you can go and see a physiotherapist and they can put a brace on the foot to help it back into alignment. And in many cases, that will suffice. But if it is a severe case of talipes, then it may require surgery, unfortunately, to address the Achilles tendon and to cut it and make it better for the child to be able to reposition their foot into alignment. But in many cases, we don't see it that often. But it does happen because the incidence of talipes is actually 1 in 1,000 babies, which is quite high really. And for some reason, it tends to affect boys more so than girls. We don't really know why that is. So that's talipes or clubfoot and the management of it. Now, let me just talk a little bit also about in-toeing. Now, what do I mean by that? It's when your baby's feet are in-toeing like this rather than out like this. Now, often we get this, see this in children when they're starting to walk. And a very common reason for this is because the arch of the foot, which is underneath here, has fallen and it pulls the toe inwards like this. Now, if your child has got fallen arches, there's not a lot you can do about their anatomy. That's how they have been born. But you will need to get special shoes and make sure that you go to a proper shoe shop and have your child looked at, because you can get shoes that are start right are particularly good, and that's where I used to go to get my children's shoes done. But you need a shoe that's built up, that's going to support the arch. Sometimes you might have to get something inside the shoe, an insole with a higher arch, to be able to bring that foot up to a position where the in-toeing is going to be reversed and more in alignment. So these are kind of common things that we see in babies and toddlers when they start to walk. So I hope you have found those hints and tips helpful, and tomorrow will be my last day going live of my 21-day challenge, and I'm just going to be talking about the role of the health visitor and how we deal with all of these head to toe conditions in our work. But until then, I hope you have a great day. Happy parenting, everybody, and do take care. Bye bye.